We begin with a University of Washington resident physician at Seattle Children's Hospital accused of diverting fentanyl and other controlled substances away from his young patients in order to take the drugs himself. 35-year-old Andrew Vogel Potadera is charged with 2 counts of acquiring a controlled substance by misrepresentation, fraud, deception, and subterfuge. We'll be getting back to Fox 13's Jennifer Dowling in just one moment to get to this story.
It's despicable, really.
Strong words from Special Agent in Charge David Reams regarding accusations made against a doctor accused of taking pain medication meant for sick patients, including children.
As a father, I'm very gratified to get someone like this out of circulation.
Federal agents say Dr. Andrew Vogel Potadera was working as an anesthesiologist resident and a resident physician at the University of Washington Medical School and was most recently assigned a rotation at Seattle Children's Hospital. Though the allegations stem from 2024, it was his brief stint at Seattle Children's Hospital where agents say an attending physician noticed something amiss and they got the case in early 2025.
They sort of caught on to his scheme relatively quickly.
Court documents state the physician reported Vogel Potadera was displaying behaviors consistent with drug use, including unexplained delays and absences, and drew up an excessive amount of fentanyl into syringes that would almost certainly not be needed for their patients that day.
Have a great deal more than he needed, and then he would either give some of it to the patient and then the rest for himself, or he would take it all himself.
This is a very simplistic demonstration about what DEA agents say was happening in this case. Let's pretend that this orange liquid is the medication. Those agents say that the syringe was being filled up beyond the prescribed amount of medication for the patients. Investigators then claim that some of that medication was given to some of the patients. However, they say the rest was then set aside for the doctor's personal use. Agents say because medication is so closely tracked and monitored, even excess medication, when it's disposed of, that medication had to be replaced with something. So they accuse the doctor of taking saline, which is essentially salt water, and putting it in the waste bin instead of the medication.
To replace with saline and take the medicine himself, take the drugs himself.
Court documents state he sometimes would take diverted medications during his shift intravenously. In some cases, medical records showed that a patient was given a medication, but Potadera never actually administered it. Documents also stated that he indicated that probably one day saline was drawn up and labeled as fentanyl and given to a patient, including at Seattle Children's Hospital.
That is the most troubling part, because a patient would only get fentanyl in a medical setting for the most severe of pain. So you've got an infant patient in desperate need of pain relief, and what that patient gets is saline solution, which is salt water.
Seattle Children's Hospital sent us a statement confirming that when staff witnessed Vogel Potadera's actions, they quickly reported it to federal authorities. Reams says it's rare to see this type of accusation against a doctor on duty. Reporting live in the newsroom, Jennifer Dowling, Fox 13 News.